To Amy, and we will start. Thank you. Thank you so much, Julia. I know some of you who are on the Zoom. I'm really looking forward to this conversation. I'm Amy Matsui. I'm Director of Income Security at the National Women's Law Center. And I do want to thank the National Academy for including this workshop, Investing in Childcare as a Public Good, in this year's conference. Today, I am joined by three amazing colleagues, and what we want to talk about and what we hope is going to be a very engaging and interactive conversation is how we can reimagine and reinvent the child care system. So I'm going to introduce briefly my colleagues. Claire Ewing-Nelson is a research fellow at the National Women's Law Center. Tiffany Ferret is a policy analyst with the Child Care and Early Education team at the Center for Law and Social Policy, otherwise known as CLASP. And Kira Miller is the State Policy and Outreach Manager for the Child Care and Early Learning team at the National Women's Law Center. Really, you all are here to listen to them, but I'm going to take the privilege of setting up our conversation very briefly. So as you all are perfectly well aware, one of the deep flaws in our economy that the pandemic has highlighted is the lack of public investment in a comprehensive, affordable, high quality, accessible childcare system. Instead of building a childcare system that supports children's development, parents' employment, family preferences, and the workforce, we have instead relied on women. We have expected women to shoulder the bulk of caregiving responsibilities within their families. We have forced them to either cut back their hours or sometimes leave the workforce altogether to compensate for the workplace's failure, in large part to compensate for caregiving needs. And we have undervalued the labor of Black and Brown women in the childcare workforce. Talk to any family or any early childhood educator, and you will know that this was never sustainable. But COVID-19 has pushed the childcare system overall, as well as working parents and working women in particular, to the brink. So what we want to talk about today is the mandate for recovery requires us to invest in childcare as a public good so that we can rebuild an economy that works for everyone. So what we're hoping to do here today is have a little kind of moderated discussion amongst the panelists. We're going to turn not too long afterwards to questions, so please feel free to put them in the chat as Julia described early on. And so what I'm going to do now is share my screen. Everyone will hold with bated breath to see me accomplish this high-flying technological feat, and then we can get started. Hold on one second. Okay, so we already did this. You know who we are. And I'm going to turn to the first question, which is talk a little bit about what we've seen and the data that has been reflected through the pandemic. So as I mentioned a moment ago, and you all are very well aware, COVID has forced us as a society to reckon with the importance of childcare to children, to families, to the economy. And so, Claire, I wanted to ask you, can you talk us through some of the data that illustrates the critical importance of childcare?
Yeah, so one of the big startling kind of headline trends that we've seen since the pandemic started are these kind of jaw-dropping numbers of women leaving the labor force entirely, which means not only are they not working, but they also aren't even able to look for work. So they actually aren't included in that unemployment rate that we pay so much attention to every month. Just since February 2020, which is what we measure as like the start of the pandemic, we've seen over 2.3 million women leave the labor force compared to less than 1.8 million men. And, there are a lot of factors driving that exit, but a big one is this kind of impossible balancing act that women are expected to do right now between being trying to work, being full-time caregivers, remote school administrators, and it's just impossible. And so for some people who maybe lost their jobs in that big initial wave of job losses in March and April. It's been impossible to look for a new job because of those caregiving pressures. And for people who were lucky enough to keep their jobs through that wave, after a few months of doing this kind of impossible schedule, it's been hard to keep the hours they would need to keep those full-time jobs. And of course, the economic crisis is only highlighting and exacerbating these inequities that we already knew were baked into the economy. In January, which is the most recent month that we have data for, over 8% of Black women and Latinas were unemployed compared to 5.5% of white men. And that's a gap that we've seen not narrow since the pandemic started. And finally, we've seen the childcare workforce itself be hit really hard. And that's this chart that I have up here on the slide. As of January, nearly 1 in 6 childcare jobs that have been lost since the start of the pandemic haven't returned. So we saw kind of a huge job shedding, as you can see in April, when providers had to start closing. And we've seen kind of incremental gains, but in the past few months, it's really leveled out, or we've seen kind of slight losses in that childcare workforce. So, I think the takeaway is that not only has this crisis showed everyone just how much we need a robust childcare infrastructure, it's also really threatening to destroy what we have right now.
Thank you, Claire. That's really helpful context for the rest of the conversation. Is there anything else that you think is important to share about, either what the childcare workforce, who they are, what they've experienced during the pandemic, in this bigger context that you were describing?
Yeah, and I think, taking a deep dive at the demographics of the childcare workforce really makes it clear that we can't talk about centering racial and gender justice in this recovery without talking about centering the childcare workforce. Childcare workforce is almost entirely women, about 95% women based on the 2019 current population survey. And Black women and Latinas are particularly overrepresented. About 19% of all childcare workers are Black women, and 20% are Latinas, and both of those shares are more than double the respective groups' share of the overall workforce. And we also know that childcare workers are paid very poorly and generally undervalued. The typical annual salary for a woman working in the childcare industry is less than $30,000 a year, which works out to less than $15 an hour. And that leads to, high poverty rates among childcare workers. We know that about 1 in 10 childcare workers have incomes below the federal poverty level, compared to about 5% of the workforce overall. And in a stat that's, particularly troubling during a pandemic, less than a third of childcare workers have employer-sponsored health insurance through their jobs, compared to over half of the overall workforce. And all of that data on salaries, poverty levels, health insurance was pre-pandemic. So we can only imagine how bad the picture is now. So, I think that's like the kind of bottom line of looking at the childcare workforce is that it's mostly women, disproportionately women of color, and these workers were on pretty unstable footing going into the pandemic, which is why it's even more important that we center them coming out of it.
Thank you, Claire. And I'm going to just move to this next slide, which illustrates some of the demographic data about the child care workforce that you just talked us through, and I just neglected to share this so that people could absorb it through visually as well as by listening to you. So at this point, I'm going to stop sharing my screen. Hold on one second. And I really want to build a little bit on what Claire was talking about in terms of the experience of the child care workforce, and turn to Tiffany and Kira to elaborate a little bit on other aspects of the child care system. So what I want to ask is kind of broadly, what has the pandemic shown us about who the failure to invest in the child care system impacts the most in addition to the workforce? And Tiffany, would you mind kicking us off?
Yeah, sure. Thanks for that question, Amy. And really want to start by building on the data that Claire presented to start pre-pandemic. We know, as Claire described, with the data points, that women, and particularly women of color and families of color, have experienced other hardships that compound with a lack of access to childcare, a lack of affordable childcare. And unfortunately, this is a story that's common. Myself, growing up in a working class household, I saw how the majority of the responsibilities were on my mom, who was a Black mother, trying to advance in career, go back for educational opportunities, and also ensure that the 4 children that she had high quality and affordable childcare that was accessible for longer periods of time. And so women of color, families of color, and Black women in particular are more likely to experience this double shift of paid and unpaid work. And this is a reality that's described in a recent article from the Brookings Institution that describes this reality of providing care and ensuring that children have care, and also engaging in the workforce through other means of work or pursuing educational opportunities. And so the data shows us that a lack of a public investment in childcare most impacts low-income families and families of color who pre-pandemic were already experiencing other hardships at rates that were higher than their counterparts. And so to invest would not only mean to stabilize the childcare industry in this moment, but also to build a more equitable system that works for all families and for providers. I also want to share some trends that come from Child Trends and the National Research Center on Hispanic Children and Families that show that during the pandemic, 29% of Latino families and 31% of Black families with children faced 3 or more hardships. So this included health hardships, such as caring for someone in the home or someone else who was diagnosed with the virus, or taking care of themselves, loss of income, and other hardships that were caused due to the pandemic. And this is a rate that's twice as much as white and Asian counterparts. And then looking at 5 or more hardships, Black and Latino families were still experiencing 5 or more hardships at twice the rate. So it just shows that without a public investment from the federal government, family resources can be completely overwhelmed or exhausted and exacerbate the harm that communities who already experience the effects of structural racism, such as lack of access to healthcare, underemployment, and a lack of childcare options prior to the pandemic, are continuing to experience now. And so, we've seen through several different research studies and really through the stories of communities and families that investing in a public system of childcare would really benefit all families, particularly those who are low income and families of color.
Thank you, Tiffany, for that really kind of rich description of families that are deeply impacted. Kira, I'm going to turn it over to you to kind of build on that foundation.
Yeah, thanks. And Tiffany, you hit a lot of my points, but I'll just add on that, the pandemic has disproportionately affected Black and Latinx families, as you noted, and even families that were middle to upper income range going into the pandemic were not protected, who are Black or Latinx, from financial stress in the same way that white families are protected because of the additional burdens they've had on them. And then also just pre-pandemic, the Asian American community and Latinx children had particularly low levels of access to child care subsidies, and we're not seeing any changes in this trend. And then also, like Black and Latinx childcare workers were already being underpaid or lower paid than their counterpart white childcare workers, and earning 78 cents less per hour. And the there hasn't been any improvement in that either.
Thank you so much, Kira. One of the other things I think that we're seeing through the pandemic is just how difficult it has been for the childcare sector to survive in this environment, whether it's because they're having to serve fewer children because of space and health and safety constraints, or additional costs for being able to operate safely, or just not being able to kind of make their margins, so that providers are having to furlough or lay off workers. For a sector that has very, very slim margins between kind of making it and not making it, it's really a knife edge, and a lot of providers and just kind of childcare workforce are really facing the brunt and getting hit hard by the economic impacts of the pandemic. Could you talk a little bit about what kinds of supports will be necessary over the next few months, which hopefully will get us through the worst of the pandemic so that we can have a functioning childcare sector on the other side? And Kira, if you wouldn't mind kicking us off here, that would be great. Thank you.
Of course, yeah. So the childcare programs need immediate relief. In December, the National Association for the Education of Young Children reported that 56% of childcare centers surveyed said they're losing money every day that they remain open. And to stay afloat, 42% are accruing debt for their programs on their personal credit cards. 39% are dipping into their own savings, and 60% are being forced into furloughs, pay cuts, and layoffs. So that said, in the short term, to sustain childcare programs, to help those programs reopen and to make childcare more affordable for families, the sector needs at least $50 billion in COVID relief funding from Congress. And that number is like increasing daily because we don't have it yet. The relief can be used for direct grants to providers, and it should be distributed to all types of providers, particularly those in under-resourced communities, to help them fill the gap between increased costs for PPE, other health and safety costs, and reduced revenues due to reduced enrollment. And then it can also be used to expand the eligibility criteria for families to qualify for assistance, lower copayments for families receiving assistance, and other steps to relieve cost pressures on families. And that's just for the short term. Thanks.
Thank you, Kira. Tiffany, do you want to add anything onto that?
Yeah, two other supports that I just want to also add. One being unemployment insurance benefits for both families and providers. So those who, because of a hardship or an economic situation, have left the workforce, to be able to still have that benefit to put food on the table and to live throughout the next several months that we know we're still going to be in this pandemic. And so the current unemployment insurance benefits expire on March 14th, so just in 11 short days. And this is something that's been included in the American Rescue Plan that's been passed by the House of Representatives and is now in the Senate. And so that would be another great support for both working families and for providers who need it during this time and through the next several months of the year. Something else that I want to add is paid family and medical leave. Both, again, critically important for working families and for providers to be able to take up to 2 weeks or 80 hours to care for someone who may have the virus, or if they themselves contract the virus, unfortunately, and not have to have the undue stress and burden of, again, making that impossible choice of, do I take care of my loved one or someone I know or myself even, or do I continue, going to work and trying to make a living to put food on the table? And so that is another support that's critically important and will be. So hoping that that's prioritized at the federal level. because it also includes an additional 12 weeks for those who are taking care of a child due to a school or childcare closure. 10 of those weeks are paid. And so, this paid leave, this other sort of, I would say, childcare adjacent benefit also directly impacts and supports working families and providers and the overall economy.
So Tiffany, you did mention that, the Senate is currently, as we speak, debating the American Rescue Plan Act and the provisions within it. And so in a way, this may feel a little premature, but in fact, it's the jumping off point of never letting an opportunity never letting a crisis go to waste. We want to make the most of this opportunity. So, I want to end kind of this moderated part of the discussion with really the question of the hour and open it up to the rest of the panel and to the participants as well. And this question is, moving forward, how do we rebuild the child care system, both to ensure that it supports the most impacted parties, but also to make sure that we're doing it in a sustainable way? So it would be great, Tiffany and then Kira, if you could just put a couple things on the table, and then we can open it up for a broader discussion.
Absolutely. So the first is something that Kira already mentioned previously is, federal investment into the childcare industry. So really looking at least $50 billion, which has been sort of the rallying cry of what we know we need, but also understanding that this is a down payment and that moving forward, there will need to be sustained efforts into the Child Care Development Block Grant and other revenue streams, whether they're discretionary or mandatory, to ensure that states, and then going all the way down to the program level, have the supports that they need to keep their doors open. And this will also help states to reimagine and rebuild the system in a way that is sustainable and equitable. States are already doing a lot of great work with what they have. And some of these approaches are digitized ways to providing information on open centers, resources in the community. But it really starts at the top. And so, moving forward, we'll still need continued investments as programs scale up and ensuring that childcare can be affordable and accessible for working families. I will also add that child care providers should be considered the small business owners that they are and receive specific small business support so that they can sustain their work. And then the last is really celebrating the advocacy that's happened, especially throughout this past year. Child care advocates have been amazing champions of, telling Congress and telling other policymakers what they need. And we'll need to continue to listen to them and to learn from them and to share their stories and messages, and also place advocates at the policymaking table to both inform and drive long-term policies and strategies. This way, the investments that come down later on will truly reflect the needs of families and providers and communities as a whole. So I would say those things moving forward will be critical.
Thank you. Kira, build on that.
Yeah, so as Tiffany said, I think that first and foremost, Congress has to provide states with certainty on continued availability of funding for child care relief, for child care funding beyond the relief funding, just to ensure that we don't return to the fragile system that we had before going into the crisis. And, once that's done, so many opportunities will open up as we are seeing now during COVID. Certain things are becoming more flexible, and we would love to see that be sustained for a longer term. And I think that when we look at strengthening policies, we really need to bring in providers and parents and receive input from them to ensure that the policies and programs that are put in place are designed to meet their needs as well. Yeah, I think, Tiffany, you hit most of my points.
Well, and this is not a surprise to everyone that this is a group of folks who have been working closely together to try and make sure that the vision for childcare is really a shared vision and one that builds a system that really does work for all of the stakeholders. So we're excited to kind of be part of that advocacy community that's worked to develop it, and we want to rope you all in to make sure that you're working with us together to build, all policies being childcare adjacent, but to have an economy that's supported by a robust and functional childcare system. So with that, I just think this is a really great point to open up the floor for questions. I know I have one that I'm just going to put on the table for the panelists, and it's a little bit more of a reframing or re-envisioning type of question. So this is, doesn't the COVID pause, quote unquote, give us the opportunity to revalue our assets and kind of re-envision the economy? Because right now we're seeing that financial markets are disconnected from reality. Do you all have thoughts that you would like to share about kind of this opportunity to revalue what really makes our economy run?
I can start with an initial thought that I think there's been a narrative shift this past year. We now use the term essential worker for those who have really been providing the essential work, the necessary work, and served as the backbone of our economy. And I think that this has been really important because it shows that the economy is people. Not just financial markets, it's the work that people do, how they invest in their communities and the services that they provide. And so something that's been really promising that I've seen, especially the last just couple of weeks, are businesses that are looking to reopen and understanding that, we may need to provide childcare as part of the package for someone to come and work at our company. We may want to open a center on our business campus or in our community ourselves to ensure that we're caring for the workers that we have. And, often, folks are providing care but aren't cared for themselves. And so I think that's been one promising thing that I've seen, but just reframing that people are the economy and we have to invest in people and invest in children in the next generation. And that should be the backbone of our economy.
Yeah, I think to also play off of that, we are seeing that essential workers are people that we are typically in low paid positions, and we are now looking and realizing these are, some of the most important positions that we have, and we need to figure out a way to make sure that they are paid more, and that childcare becomes affordable for everybody as well, because we really can't keep going without it.
Yeah, and I think just kind of to wrap up, I think, we say over and over again, the stock market isn't the economy and the stock market won't save us. And I think this crisis has just really, really highlighted that when you have a stock market that's ostensibly doing fine, but Black women's unemployment is still over 8%. There's just, there's no way to square those two. You have to focus on the people who are actually being affected. And I think, broadly, the other thing that I hope this crisis has showed everyone is that everything is childcare adjacent. We can't talk about equal pay without talking about childcare. We can't talk about health insurance without talking about childcare. All of these issues are connected, and we have to really approach them holistically and remember the people who kept us going throughout this crisis, who were the essential workers, who were overwhelmingly women and women of color.
Thank you all for those responses. I'm going to just kind of read out Anna's question from the chat, which kind of builds upon this question of the business sector, the private sector community. And that is, is business support translating into support for public policy around, rebuilding a childcare system? Is there anything that you all have seen that is worth highlighting here?
I just want to highlight, I think, the values piece of this conversation as well. I think historically, as a society, we've seen childcare as women's work and, not necessarily a public good that should be invested in. And I've seen that shift this past year during the pandemic of, it's gone from a kind of private and privacy sort of conversation to now an understanding that to get to work, childcare is essential. And so companies like Google and others are really looking at investing in childcare within their own sort of business model. And so I've seen that as a growing trend. Hopefully, once these folks take it on as a value of their own, who have public platforms can continue to amplify, along with advocates and communities who have already been doing this work to change policy, will continue to change policy. But I see the values pieces as being really important in being able to translate into the policy aspect. And I think that's starting to happen with some of the large investment proposals for childcare that we've seen. Again, this will be the first of many steps, I think. So just to continue to use those stories of folks who understand that childcare is essential to continue to push policymakers will be important. But I think that is starting to change, yes.
And certainly there's been longstanding work, and I'm thinking in particular of the Chamber of Commerce Foundation that has done a lot of work historically around early education and directly tying that to support for the workforce. And, I think that there's been definitely the groundwork laid for, this tremendous need that there's going to be to kind of have a robust childcare system to get people kind of back into the workforce and make sure that women are not kind of overwhelmingly lagging in being the ones to go back to paid work. Any other thoughts on that before we move to the next question? Okay, hearing none. Another question that has been asked, this is from Alicia, is with the recent influx of childcare investments from the federal government, how can states work to make sure that the money goes out equitably? And Kira, if you don't mind, I'm going to lob this one over to you since this is squarely in your bailiwick.
Yeah, so I think that just one of the ways that they can make sure it goes out equitably is by giving it to certain organizations who maybe work with communities of color, specifically, women-led. Would be great to make sure that the money is getting to providers who maybe aren't getting, who were under-resourced or in under-resourced areas, just to make sure that it goes out equitably to everybody. But I think it's always a difficult way to do that, and also just making sure that it goes out to all different types of providers. Family, friend, and neighbor care is often overlooked, and a lot of times they don't know that they might be able to have any assistance. So just finding ways to reach out to them, which can be difficult, but also, again, in reaching out through the community itself can help the money get out. And I don't know if anyone else has anything to add on that.
Well, that was pretty comprehensive, Kira. So I'm going to turn to the next question that has been raised in the chat. This is from Catherine Harvey. And her question is anyone organizing parents around the vision for childcare? And she speaks as someone who's new but deeply invested in the issue.
I can jump in. I think that parents have always been at the center of organizing, which is great. Parents are, you know, integral in their communities as well. And so I think, kind of thinking about it in a formal sense, there is a group called Moms Rising. That's a national organizing group. And I know my friends at the Law Center and my organization, we work with several advocates from Moms Rising, and they do amazing work around the narrative conversation, you know, in terms of letting folks know that childcare is a public good, sharing their own stories, raising their issues to elected officials. And so they're one group that I would pinpoint that's doing amazing work around childcare and the need for a public investment, and are really active and vocal, and also have this deep equity lens. There are moms, parents from all backgrounds who are really amplifying this as an issue that needs to be prioritized and as a public good. So I would say Moms Rising, they're great.
Okay, I'm going to move on to the next question, and this is from Michael, who's asking about the opportunity that might be presented in public trust doctrines. So I think I'm one of the legal professionals on the panel, and I have no idea what that is. Michael, do you have any, like, a little bit more detail about what that entails? And I will try not to butcher it.
Yes, some assets have been treated as so valuable for public use that they are not, they're not private property that can be exchanged, but they're held in trust by the state for the benefit of all the people of the state, with the inclusion of future generations, which almost no one else thinks about. So anyway, that's the basic idea, that public trust assets have always been protected and they're inalienable in economic transactions. So basically, historically, even the Roman emperor couldn't give them away. That some things are too important for civic use to treat like property. And each
Well, that's
state
a really, yeah.
in the United States has a public trust doctrine. It was historically used to provide access to commerce, navigation, and fisheries, but it's always been part of the constitutional tradition of every state. And this is where it's so important, because the Supreme Court is so out of touch with actual law and rule of law. And public trust doctrine, there's a lot of common law. And I was just wondering if any of you had thought about that in terms of, well, in childcare as a public trust.
Well, I really appreciate your raising that. Not that I know of, but there are a lot of resonances, I think, between the framing that we're trying to employ here and have be more broadly adopted of childcare as a public good, and really being a fundamental aspect of the economy that, as Tiffany was saying, shouldn't be something that individual workers or families are responsible for providing, because it really is, you know, in a way, economic infrastructure that allows everyone to go to work and every business to have its workers succeed and continue to be employed. So I'm going to take that back to other legal professionals and non-legal professionals to kind of explore that a little bit more, but thank you very much for raising that. Okay, and the last question that I see here that I'm going to raise is Julia's, which is asking whether, and I'm going to read her comment. Anecdotally, I've seen many parents realize how much they were spending on childcare once childcare is closed, And since they've developed patchwork childcare arrangements in the meantime, using neighbors, grandparents, older children, and are hesitant to take on the cost again. So the question is, do you think a childcare subsidy for families will help solidify childcare work by increasing participation? So I don't know if Kira or Tiffany, you want to start by tackling that.
Both of us were like, do you want to start? Do you want to start? I can start. I think that, yes, that'll be part of some of the solution looking forward. I also think that there was a high number of centers or other sort of care environments that closed completely during this time. So it'll also be looking to how to reopen, to look at the data in areas that are what we call childcare deserts, or that lack enough childcare options to be able to create more centers and to hire more workers, looking at their wages as well to ensure that folks will enter into the childcare workforce. So I think that's part of the solution moving forward, but also just ensuring that there are enough childcare options within a state or within a community for families to have, and that those areas have the investment that they need to sustain being reopened. So that's part of it. Something else I think that will increase participation is vaccination. And so, you know, some providers may not feel safe reopening until they've been vaccinated. So that's another piece of the puzzle as well, I think.
Yeah, it's like you stole the words right out of my mouth.
Thank you both for mind melding and making that response super efficient. So thank you. I have one other question that I want to put on the table, and then if anyone has closing thoughts or kind of ways to close us out and send us out into the world to help transform childcare into a public good. So the last question I have, and Claire, you might be best situated to kick us off, is do we know how having childcare or not having childcare might impact women's longer term economic security?
Yeah, so I think this gets back to the these leaving the workforce numbers that we've seen where, you know, lots of women are just dropping out entirely, and coming back from that is going to be really hard, especially in the kind of slow non-recovery we're seeing. Like it could be quite a long time before those women who have been unemployed for a long time or out of the job market entirely are able to come back. And you know, for a lot of people, when they first re-enter the labor force, they're forced to take a lower paying job, which, you know, is only going to compound the kind of gender and racial wage gaps that we already see. And that has a lot of kind of downstream effects from, you know, not just like current economic security, but being able to save for retirement, being able to pay, you know, unexpected medical expenses, you know, all of those kinds of things. So I think we're going to see the fallout from this kind of immense caregiving crisis for probably decades to come, especially if we don't act quickly to address it.
Thank you. And before we kind of close this out, I'm going to project onto all of you something that I frequently do on panels, which is kind of forget the one key thing that I really wanted to get across. So if there was one thing that you wanted to highlight or kind of bring to the forefront before we close out, what would that be? And Claire, I'm going to put you on the spot again and start back with you.
Yeah, I think the one thing that comes to mind a lot when I think about childcare and about the childcare workforce is this idea of like impossible math, that we're number one asking women to do impossible math with like the number of hours in the day, and asking, you know, childcare workers to do impossible math with this, you know, incredibly essential, incredibly difficult job that they have while being paid, you know, poverty level wages. And I think this really comes across when we look at like how unaffordable childcare is for families, is a complete paradox with how underpaid and undervalued childcare workers are. You know, the typical like year of infant or center-based childcare for an infant would be over a third of the annual salary for a typical childcare worker. So it's just, yeah, the numbers just don't work. So that's kind of the one thing that comes up anytime I talk about this issue.
Kira, what is the one thing you want to leave folks with?
Yeah, I think that childcare, you know, it is the backbone of our country, and we need to really, the pandemic has opened up and really shed light on that. Not only do we need to pay providers a fair wage, but we also need to make it more affordable for families. Families can't put their child in childcare if they don't have jobs. And right now, like, we need childcare so people who have lost their jobs can get new ones or go back to work. And it's just chicken or the egg right now. Also, we need providers to be able to provide the best care they can. And so we need to be able to pay them well. Just going off of what Claire said, it's a weird math that doesn't add up.
And Tiffany, close us out.
Sure. So my takeaway would be that a public good is a public good is a public good. And the same way that we invest in other infrastructure like roads and bridges and our K-12 schools, childcare is another piece of our infrastructure, of our workforce and our economy, and some of the first experiences that children have in their lives with caring adults. And so the same way that we invest in other systems of infrastructure, childcare should also be prioritized as the public good that it is.
Thank you. Well, I am sure that you all can see why I was so excited to be the sidecar for this fantastic panel. We hope that this conversation was as energizing and exciting for you as it was for us. We definitely want to make sure that we are making ourselves available to continue the conversation. So our contact information is here. Please do not hesitate to reach out to join the ranks of folks who are advocating for childcare as a public good, because we need it for our economy to move forward on an equitable basis. And I know I dropped some resources in the chat, and these are going to be made available for you, but we will make sure that we're sharing kind of the data and resources that grounded this conversation. And with that, I just want to thank everybody for joining us today, and look forward to continuing the conversation.
Thank you so much, Amy. That was just, and the panel, Claire and Kyra and Tiffany, that was fascinating. And the chat re-ups my comments. They all are like, that was an amazing panel. I loved it. So that was just so good. Thank you all for joining us for this workshop. And hopefully we will see you tomorrow for our last day of the virtual conference. And like Amy said, we'll be sharing all of the information after. So I hope you'll complete the survey. Thank you. So I'm going to be using that impossible math. I'm going to be running around my house screaming that all day long. That is the best phrase. I want a t-shirt, impossible math. Anyway, so thank you guys so much. And we will be sharing all the resources after. See you tomorrow.